Now that will lead us to our first discussion segment here on the Super Morning Show, and of course we already have our guest seated this morning to talk about drugs and its effect, let me say, on the population, how government, how the region, the sub-region, and how other individuals, institutions are contributing towards ensuring that the effects are minimized, and our country, our region is a safe haven for young people. And so this morning we have here in our live studios Mr. Yao Akwasa Sapon. He's a former Ghana NACOP General Secretary. Mr. Sapon, good morning, welcome.
Good morning.
May please use your headphone.
Yes, thank you.
All right, thank you and welcome to Liberia. Is this your first time in our country?
No, I mean I'm a West African citizen.
Yeah, so you've been traveling.
I've been traveling quite a bit. Yeah.
Okay, wonderful, good to have you here, and let's begin just by telling our listening audience, now viewers, a little bit about who Mr. Sapon is.
Well, I am the immediate past executive secretary of the Narcotics Control Board of Ghana, what you would call the Director General of the Liberian DEA. I retired in November 2016. I'm a very good friend to the Director General of the DEA here, Mr. Anthony So. I have a lot of respect for him. We have mutual respect for one another. And I must commend his role in shaping drug policy in Liberia. I'm also a pharmacist, and I'm also a lawyer. And when Rawlings, I'm sure Rawlings is a household name in Liberia. When Rawlings had made his coup, the revolution in 1981, I was appointed a minister. Then we called it the PNDC secretary. In the US, you call them Secretary of State. So we were PND secretaries. I was the youngest PND secretary that was appointed in February 1982. So I became involved in politics and activism very early in my life. And I am, even whilst I was a member, I was the executive secretary of the Narcotics Control Board. I was notoriously known to be, even when in government, to be asking for a review of a real look, if you like, of drug policies across the African continent, because I thought that we were not being realistic about the approaches.
We were not being realistic about the African approaches. So that will set the basis for our discussions, which will focus on the impact of drugs. First of all, you've worked in your country, you've worked in parts of the sub-region and the continent. What's your own observation? What have you observed so far about drug issues on the continent, or let's say in the sub-region?
Yeah, that is the disturbing thing. I mean, without a doubt, drugs is a problem. Drug use is on the increase. Drug abuse is on the increase. Trafficking of cocaine and heroin is on the increase. But the largest problem is the trafficking, use, and abuse of cannabis in the sub-region. Now, when I say that, so of course, if it's a problem, then it has to be resolved. How do we resolve the problem?
It's a problem. How alarming is this problem? What sort of effects, what sort of major signs we see that will prompt you to say, oh yes, this is a serious issue that needs attention?
Well, if you go to every country, I mean, let us face the fact. I mean, this is, if you like, let me put it this way, the social language. Go to any ghetto, go to in the streets. It's important in making this assessment to look at government statistics and to look at social language statistics. Ordinary people in this country, in Ghana, in every African, know that cannabis is a problem. They know that people are growing it, people are using it, people are being arrested. But we also know that those who are being arrested are not the big timers. The small timers. It is soft targets. It's very easy to get to know. We are getting addiction problems. People who are addicted to it will go into petty thievery because they have to be addicted to it. So that is our problem we have in this country. So when I say it's alarming, it is alarming. Talk to mothers, talk to parents, talk to colleagues, peer groups. You see that it's a big problem. You go to a ghetto and people are smoking, with impunity. And I'm saying that if that is the problem, how do we resolve it?
Before coming to resolving or coming to possible solutions
Yes.
for such a problem,
Mhm.
what do we attribute as factors that have contributed to the status now where you think is alarming truly right in our environment is visible? What are factors contributing to it?
Yes, that is a very important fact. First of all, there's availability, and one of the reasons why there is availability is wrong policy, because you have made it illegal. So the thing is an illicit market. It is controlled by organized criminals underground. History will tell us that it was the same thing with tobacco. It was the same thing with alcohol. Once you make something, you make something illicit, when there is clear evidence that there is a popular attraction to it, then you have to be extremely careful. That is one, wrong policy. But two, also, in many of our countries, parents are not taught how to appreciate adolescence. It is something that, all of us are lucky that we went through our parents and we are safe. The school system, the parenting system, the church system, we are always preaching to our children, don't do this and do this. And yet in the adolescence, all of us want to try things. We either try alcohol, we either try cigarettes, we either try cannabis, we try fuel, ointments. People are sniffing these things. So when these things do happen, peer pressure is one. Broken homes is the second one. And the third thing is that people have different responses to these substances. I may try the substance once and I don't like it at all, so I'll not get to it. There are others who may not have the capacity to resist. So that is the third thing. Is not about it is what you call the genetic disposition. It is not that the person was born to it, but his makeup is such that once he takes it, some people just reject it totally, and some people get used to it.
So are you saying that bad policies, particularly making drug an illicit business, an illicit thing, is really bad, is wrong?
You see, first of all, let me underline the fact that law enforcement is very crucial in this matter. Law enforcement extremely crucial in this matter, because law enforcement helps public safety. That is one. It also helps in the reducing of the availability of the drugs. It also discourages drug use. So law enforcement is critical. In the drug chain, you have producers or manufacturers. Then you come to the harvesters and the wholesalers. Then the retailers. Then the end users. In this chain, the biggest profits are for the producers and the traffickers. But the softest targets are the users. So it is very easy to go and arrest a bunch of users who you claim are riffraffs and make a lot of sensational news about it and say that you are being tough. That is wrong. So all that we are saying in policy terms is that, look, put it on the law books, no problem. But let us go for the big time traffickers who are actually, because I said the crucial role of law enforcement is to reduce the availability of drugs. To reduce the availability of drugs is not to catch the end users. It is to deal with those who are producing it, who are making it available on the market. And so the metrics, the indicators by which you measure things ought to be this.
So you were saying that there needs to be probably an amendment to some of the laws or the policies that directly go after people who produce. But now, facing the fact this issue about drug is something that has a lot of money in it. So you will know that lots of big hands will be connected to that. That makes it even more difficult for law enforcement to get to the bottom. How do you think policies can help in this case?
Yeah, that's the point I'm making. That look, first of all, let us as a policy say that those who are most affected health-wise are the users. All right? The users are the most affected health-wise. So all we are saying is that let us divert some of the resources in law enforcement which we are using to deal with, just go on dealers, the end users. Let's divert them to promote health problems associated with drug use. That doesn't mean that law enforcement is not important, because the criminal organizations control the market, the trade. They have a lot of money, and that is why we must go for them. Otherwise, they amass more money and they corrupt the law enforcement officers. Because it is very clear that right across the West African sub-region, right across the African sub-region, why is it that in every country, if you look at the statistics, the people who are being arrested, more of the users are being arrested than the traffickers?
And probably because the producers are people who are big hands. But let me hold you right there.
Well,
and John Afonso Kwene, who just joined us in the studio. He's a focal person in Liberia for the West Africa Drug Policy Network. Afonso, good morning. Welcome.
Good morning.
Now, you have to come closer to the microphone. Now, basically, your take as to how this whole issue about curbing the use and abuse of drugs can really be realized in Liberia and the sub-region.
All right, thank you. All right, the West African Drugs Policy Network, it was funded 2003 in Accra, Ghana. The rationale behind here is civil society long ago have not been active participants in decision making, most especially in the area. And survey research from various West African countries, we realized that the youth are highly affected, and government continue to pursue old policies that is not working. So as civil society organizations in this region, we believe that the issue of drugs is a transnational crime that affects every country in the region. So the only way there can be a policy change, there should be advocacy based, evidence based, advocacy to lobby with stakeholders and decision makers that indeed criminalization of users is not the solution to the problem. So now our fundamental principle here is drugs policy now should be embedded with public health. All right, should be embedded with public health, because if you look across this region, like in Liberia's case studies, there's no rehabilitation, there's no harm reduction facility in Liberia. We term them as Zogo. Nobody, working towards reforming of the guys. These guys need to be reformed.
So the point is that drug users should using drugs, abusing drugs, so the use and abuse of drugs, that is particularly looking at the end users, shouldn't be more of a crime.
Yeah, I mean, look, drug addiction is not a legal problem. Drug addiction, when we make it a legal problem, we are insulting the conscience of the ordinary man. Malaria is a blood-borne disease. It is not a legal problem. So why should a central nervous system disease be a legal problem? When somebody smokes and becomes addicted, and it's not really drug addiction, there's gambling addiction. Go to all of these countries. I mean, with the influx of, I don't know what has happened to West Africa. Everybody's gambling. There's a gambling. There's what we call internet addiction. The addiction is a problem. It is a disease. So let us treat it as a disease. This is very important. That is why it has to be public health oriented. When you make drug addiction, a legal problem, you reinforce stigmatization. You do not put resources into what really is a health problem. And all that we are saying is that let the law enforcement deal with the big end, the production and trafficking end of the chain. But the laws in place now are allowing people who are small-time users and small-time possessors to end up in jail. And it suits politicians to make and police to police top brass to give the impression they are working. That is not a solution. The solution is, let's put resources into drug addiction, but let us fight the availability. Let us fight the drug traffickers, so that, for example, I would want to see as one of the things that social civil society organizations insist on, including the media, if 10 users are arrested, the question we must ask the police, the question we must ask the law enforcement agents is, how many producers were arrested?
Okay, but not only users are usually arrested. People who traffic these substances, people who take them from one place to other, people who deal in them, people who own ghettos, they're also arrested.
We have no problem with that. That is the point I'm making. That the traffickers must be dealt with. They are the ones who are making the money. The producers, the traffickers are the guys who are making them. Sometimes you see somebody swallowing. Those are mules. Law enforcement must use its intelligence network. Law enforcement must use its intelligence network to do what? To get those persons as friends. The big time traffickers. You see, the problem is that's why we're talking about the law. We're not blaming the police. We're not blaming the drug law enforcement agencies, because that is the law. So we are appealing to the lawmakers that look at the law again. Because if you look at the law again, then small possession and use will not be criminalized.
Okay, so I know of now that Liberia's drug law or trafficking drug I'm sure is not a billable offense. I'm sure it's still a billable offense, but we'll get more of that from the Liberia Drug Enforcement Agency director who's just joined us, Mr. Anthony Saw. Good morning. Thank you for joining us.
Good morning, ELBC. Good morning, Liberian people. Happy to be here to be a part of this discussion, because it will lay some clarity on some of the issues that maybe our public don't understand. Thank God that one of our friends from the West African region, for whom I have so much respect, is with us today. So I'm happy to be part of the discussion.
Okay, so let's begin on what you are directly an arm of government dealing with the issues concerning drugs, illicit drugs addiction, drugs use, drugs abuse, drugs trafficking, or what you can talk about drugs issues in a country. Currently, as we stand, what measures are in place actually to combat not just the addictors, if you may, but those who are producing trafficking drugs? What laws are on the books?
Well, to begin with, I just want to lay the foundation for this discussion so that we can follow.
Right.
The issue of a drug was made criminal by the United Nations Conventions, 1988 Convention. There are 3 conventions that member states of the United Nations have been able or have been asked to enforce. 1961, 1971, and 1988. Okay, and in those conventions, the general consideration, the general objective of pursuing illicit drug, and other harmful substances, the general consideration is to save life. That is the main objective. So, in our effort to save life, there are 4 major components. As a member of the United Nations, we have the legal framework. The emphasis is made on the adequacy and the efficiency of the legal framework. Every country must develop adequate and efficient legal framework. From there, a member state must have illicit drug control supply chain control, which is normally taken care of by the law enforcement. Then you have the demand reduction component, which has to do with treatment, awareness, and other considerations that we are talking today. This program is talking about demand reduction. Then we have within the convention require us to have also illicit drug, those pharmaceutical drugs that are coming, those chemicals that are useful for our agriculture and other medicinal purposes. There must be a control mechanism also set up by a member country to take care of that. And these are all components that must begin the effort to fight drug in a country. Now, for us in Liberia, our national drug policy took into consideration all of these components, and we have designed a operational framework that takes care of all of this. We have developed a drug law. The drug law is in effect right now. It's very, very adequate. Efficient, I say no, it's not yet efficient, because when you talk about efficiency, you should have a specialized court, you should have a specialized prosecutor, you should have specialized people, forensic lab, and all of these things should be in place, for efficiency. So that when you go to court, by the time you present the case, you have ever-ready evidence to convict whoever. Now, the law enforcement side, that has been also taken care of. The Liberian Drug Enforcement Agency is in place. We have the pharmaceutical board that takes care of the pharmaceutical drugs that come into the country. Then we have Liberia Medicine and Health Product Regulatory Authority here that monitor and follow the issue. Government has set up all of these things. Now, the demand reduction section, which is part, and the most important part that the world now is shifting to, has been considered ever since. And in our national policy in Liberia, we have a drug demand reduction provision in our law that is being taken care of. It has not been effective because we don't have the facility. We don't have the drug. We don't have the facility, to implement the thing efficiently. But there are efforts.
Okay. So there's no facility at the moment to for rehab,
For rehab. But we have teams in place that go around create awareness. We have teams in place that when you are really sick with drug, there is a hospital here, they call it
on Dubu Road?
Yeah, on Dubu Road. That is taking care also of drug use disorder.
Okay. Now, but the question now is...
what I'm saying is that we have not reached a point where we have up to standard institution that will take care of these things. So
Sapon is proposing moving to the point that drug producers, drug traffickers should really be dealt with. So does the law we have on the books here in Liberia make drug offenses, particularly trafficking in drugs or producing drugs, a billable or non-billable offense?
Well, you see, the question of billable, I don't normally dwell into billable. Bill is a guarantee. Under the law, bill is just a guarantee that yes, you sue me, I will come back tomorrow, and you should be able to come. Bill is not a punishment.
Yeah, but
bill is not a punishment.
Because a person arrested today with a huge quantity of marijuana will go to jail, and then after the next few days he's out, he's going back to where he came from. So
okay, no, it should not be that way. If somebody who is arrested with huge quantity of marijuana, the drug enforcement agency or the police or whoever the law enforcement is has 48 hours to keep you. And after the investigation, we send you to court. When we send you to court through the Ministry of Justice, that means the county attorney, the city solicitor, whatever the government lawyer is, takes care of that case from that point. But under the law, an accused is presumed innocent until proven guilty. Okay?
Even if you have substances,
Yes, until proven guilty. Then, here is the situation here. When the man reaches to court, then he has a lawyer too. That lawyer will plead on his behalf. my clan did not do it, and this and this and did that. Even if we had the most powerful evidence, we will listen.
Okay.
The court will listen.
Okay, so
to the defense.
Okay.
No, I mean,
I want to hold you right there and John support and ask whether you agree.
Yeah.
You agree with
so
them.
for us, no, I just want to conclude my statement. So for us in Liberia, drug trafficking is a felony of the first degree, provided you traffic in Schedule 1 or Schedule 2 drug or Table 1 or Table 2 drug.
What is Schedule 1? What is Table 1? What's Table 2?
Okay.
Schedule 2?
The United Nations has set category for all of the chemicals and drugs that we are calling today that the convention was produced for. Now, marijuana is a Schedule 1 drug. And if you traffic in marijuana in Liberia, Schedule 1 drug is felony of the first degree.
Regardless of the quantity.
Regardless of the quantity. When you possess, trafficking in it, I don't say use, trafficking in it is a felony of the first degree according to our standard, our legal standard here.
A serious crime.
Serious crime. Now, when that man reaches to court, he has a lawyer. The lawyer will plead on his behalf, and the judge will listen to both parties because judge is supposed to be neutral.
But crimes like rape, like murder, you very hardly get a bail. So once you're accused and the police arrest you, and of course you have 48 hours, the police follow you to court, you will stay in jail until you
yeah, but
tried.
Unfortunately, the drug law is a felony of the first degree, and it's not yet non-bailable offense.
Okay.
So when you are placed on bail, it behooves now the prosecutor to ensure that this man who is on bail should come back and answer to the case that you were accused for.
Okay. Now,
okay.
Mr.
Now,
Sapo, let me
your failure to
you
come.
have another chance to come in.
Right.
Let me come to Mr. Sapo and ask him. You calling for tougher actions, particularly against people who are termed as producers and traffickers who make the availability of the drug. Do you think the law, the way the structure, I mean, in Liberia and other countries, making it a little bit softer in terms of keeping the person jail? You think is that strong to move on?
Well, the point that the drug reform movement is also we are saying is that look, we need to relook. Even if a government makes a policy, a reasonable policy is reviewed in 10 years. You cannot have things in conventions for 60 years when the assumptions, the fact that it's an international convention does not mean that the assumptions are right. It's extremely important. That's what we're saying. As for the conventions, we have signed them. The laws are there. The reform movement is all the reform movement is saying is that let people begin to debate. The dialogue should continue in each country continually. Because I mean, like Anthony is saying, if it's on the law books, it's on the law books. The police can do nothing about it. But that is why we want the dialogue, a national dialogue. People should continue debating so that we will remove, for example, when you talk about possession, everybody knows in law that there's possession for use and possession for trafficking. So, for example, in the reform movement, we are saying that in the law books, let's make a separation between possession for use and possession for trafficking. That is a reform thought in law that we are talking about. But the point that Anthony raised is also very important. You see, sometimes we blame the law enforcement for nothing. When the law enforcement arrests somebody, one of the efficient things that he's talking about is that one of the things we are asking for is that all the drug law enforcement agents must be given the capacity to prosecute themselves. Because they did the arrest. Let them do the prosecution. Give them attorneys to do the prosecution, because when they arrest and you give in to a prosecution, if the prosecution does not understand the nitty-gritties of the law and how serious it is, they can take a laissez-faire attitude to it.
Okay, so it's more of like pushing for revision to ensure that all of these various components that the DA law enforcement agencies
in every country, in every country, the drug traffickers and the producers, they get a higher sentence. Right. The judge will look at the circumstances. It's very, very important, because at the end of the day, when you write a law, it is for the judge to look at the evidence and the circumstances. So all we are saying is this, that the policymakers must, because Anthony cannot do anything about it.
Definitely.
The policymakers must change the law. They must come out with a policy which says that, look, let us ensure that those who use and who possess for use small quantities, let us not take them to jail. Let us give them warnings. Let us send them to committees to dissuade them. So, for example, let me give you an instance. Why would you arrest somebody with a joint that costs $5 and put him in jail, even on remand? You remand him in prison for, say, 3 months, because the prisons are choked. He learns more tricks. There's injustice. When the main man is out there, the one who produces. So, like I said, the drug law enforcement, we must allow their role to be public safety and reduction of availability of the drugs.
Okay, so let me now remind our listening audience and of course our television viewers that you're listening to the Super Morning Show. You're watching the Super Morning Show, and the issue under discussion is the impact of drugs, the challenges of government in responding to Liberia's drug problem, and let's expand it to the sub-regional problem, and of course those issues like the diseases associated with people who are involved with a drug addiction, HIV/AIDS, tuberculosis, hepatitis C, and all of that. How do you deal with them? So let me quickly tell you that our guests this morning, we have the Director General of the Liberia Drug Enforcement Agency, Anthony Saw. We also have Alfonso Quena. He is a focal person, Liberia focal person of the West Africa Drug Enforcement Agency. And with us, Yao Akrasi Sapor. He is a former Ghanaian NACOP General Secretary. So the numbers we can call when we come, actually we'll give you the alert to call, but let's announce the numbers: 0776 089 713, 088 0514 096. The numbers to call, and you will be live. Now, just before we go to the lines to take the calls, let me come to you, Alfonso. Currently, with the issues glaring, the need and ways to go in making sure that this drug issue is not targeted at those addicts, but it's targeted, in terms of rehabilitating them and getting to, punish those who are producing. What you think can be done at the moment? Government knows about this, like Mr. Saul said, but how do we encourage and engage the kind of change we want to see?
All right, we should learn from some other nations around us here. Our concern here is public health should be the center pillar of drug policy. All right, as you regularly stated, you may mention HIV/AIDS, hepatitis C, and what have you. Studies in our possession from many countries in Africa, in West Africa, and around the world here is the repressive way of handling drug users is not solving the issue of HIV, AIDS, tuberculosis, and hepatitis C. These people have right to health. All right, they should not be stigmatized. Addiction is a brain disease. Landing them into jails, it will continue on, to exacerbate the issue of HIV/AIDS and some other diseases.
So how do we engage government?
That's what we're doing now. That's what we're doing now. That's what we're doing now.
Besides this, how do you intend to engage government? Besides the media engagement, how are you engaging government?
All right, the West African Civil Society Organization, the West African Drug Policy Network in this region, we are continuing to carry on stakeholder consultations in various countries.
Okay.
All right. This year we should have a stakeholder consultations with lawmakers, but have been postponed to next year because of our election. Because we believe that some of the lawmakers are not going back.
Good. And the lawmakers are those who in charge of making the laws.
All right.
So it's a good time. But
all right. Another thing that we're doing here is the West African Drugs Policy Network doing our studies on drugs trafficking, the impact of drugs trafficking on political governance. All right. The West African. All right. Because we want to know what influence the drugs money have in terms of elections in West Africa. Because we know that these things are big money. All right. So our scope of work, is not limited to only this. All right, we believe that if we continue to advocate for these issues that affect the lives of young people in this region and the security of people in this region, the government will listen.
Okay, so let me come to Mr. Saul. Mr. Saul, you heading the DEA or LDA as it is called now, and you're direct representative of the government. You know that government complains of this issue of lack of funding, competing priorities. I mean, with the challenge you're encountering already in government, how possible you think this idea of building additional rehab homes and giving the kind of attention drug addicts need?
Well, thank you very much. We are making frankly effort in that direction. We are in contact with the ECOWAS plan of action. In fact, from June 20 to June 22, they were here on assessment mission, and they have taken into account all of the facilities we have and what we don't have with our recommendation, and that has been taken on board. There are goodwills out there. There are a lot of goodwill out there. EU is prepared to help us. EU also has a plan of action against drug that is also supported by the ECOWAS plan of action.
The US Embassy?
Yeah, AU,
Okay.
African Union. Okay, and all of these organizations we're talking about, and all of the sub-organizations in the region that they're talking about, Liberia is a full member, a full due pay member on board, and represented by the humble servant today. My colleagues from Ghana, when he was in service, he and I attended almost all of the drug conferences around the world. We went to all of the workshops. We went to all of the
international engagement.
Yeah, international engagement and other things. Even we went to UNGAS.
So is there light in the tunnel for Liberia?
There's light there's light at the end of the tunnel. What we are saying is that the Liberian Drug Enforcement Agency or the police or whoever the law enforcement is, that we have never been in the habit of arresting drug users. There is a difference between drug use and committing crime. Okay. If a drug user, because of his appetite, went and armed robbed, that drug user will be punished for armed robbery. Okay, that's not drug use now. And if a police that is in charge of maintaining peace in our community get to know that there's a community of people who hijack people, poison, and other things, they will raid it. It's not because of drug use. They are raiding it because people from there are robbing and hijacking people things. So there are two different things there. So I want the public to understand.
So the law enforcement, agency, or the state security do not.
We have the responsibility to maintain peace. We have the responsibility to ensure
these agencies do not arrest based on addiction. They arrest based on the kind of harm.
The kind of harm they pose to the public.
Okay.
If you hijack somebody's bag, a lady bag at red light, and the police handle you, that does not mean. But you could be a Zogo. You could be a Zogo. They call the name. But for me, I don't prefer stigmatization. The convention speaks against stigmatization. I just want to make an honest appeal today to our Liberian public that calling our own children Zogo and other things will go a long way in affecting their future. So we should consider naming them. That is not by convention correct. Okay, so but what we are equally saying is that our children are out there, they need help. We are trying to do everything to help. Grand Hospital here has been taken over by JFK. If you go there, you see most of the drug users there. Even during the assessment, during the evaluation mission, when DC, ECOWAS, and AU representative came to Liberia from the 20th of June to the 22nd, we visited Grand Hospital. And the lady in charge there is doing very well. But because of the limited resources government has, cannot be the blame for somebody saying you're violating. We are aware. The convention is very clear, and we have modeled our law on the convention.
Okay.
And this law reform that my colleagues from Ghana is talking about, we are fully member of that committee. Sooner or later, we'll be going to Ghana to sit down with experts, talk about these things, and until our government, different government can buy it and put it into law, the available law will be enforced. And the available law in Liberia is not mean to the drug users.
Okay.
It's not mean.
Okay, so
the available law in Liberia protects the drug user as well. You remember that since we took over DEA, we have not been in the business of arresting drug user.
Okay, so let me hold you ready and go to the lines. I'm sure the lines are blinking here. But good morning. Thanks for joining in the conversation. Please go ahead. Okay, Reverend. Actually pushing a point. So let's take our closing comments. Basically, this is an issue that is evergreen, continues to be discussed until there is a change. Beginning with you, Mr. Sapor, we can take your parting comments on this issue.
Well, for the drug reform movement, what we are saying is that the drug issue is a sustainable development issue. If you look at the Agenda 2030, the Sustainable Development Goals, 169 targets, 17 goals. Goal 3 is about ensuring the well-being and health of people. And goal 3.5 actually says strengthening the prevention and treatment of substance abuse, including narcotic drug abuse. And all we are saying is that since we have Agenda 2030 was signed in September 2016 by all governments at the United Nations, let us take that target seriously into policy making so that we will make resources available to, and we're also urging faith-based organizations and private sector go to the, as one of the key things is what we call common responsibility. Please, the work of DEA, Liberian DEA, is not just for them. It is for the general public. And it's important that faith-based organizations also enter into treatment. Private individuals should go into rehabilitation centers. And that would go along with. Government can't do it all.
Okay.
Thank you.
Thank you very much. And I know there are several other institutions that are involved with that. Mr. Sawyer,
yeah, thank you very much. What I have continued to say, and I will always say, is that for us, we are very lucky in Liberia. We have a legal framework that is very balanced, that takes into consideration all the provisions, international best practices. We have harm reduction as well in our law. We have demand reduction in our law. But the provision of the law also provide for stiffer punishment for traffickers. Trafficking, even in marijuana, a felony in the first degree because it's Schedule 1 drug. So we have not been sympathetic to traffickers in any way. I mean, ELBC is here. I listened this morning, the quantity of drug that were born in Ghana, the quantity of drug that were born in Monrovia, in all of the countries around here, is because of the effort we are making. We are after the trafficker.
Well, you hardly get, many of them convicted.
Yeah,
get the drugs and burn them.
The thing is, as my colleague has just said, prosecution and judiciary, when cases go to court, the law enforcement become witness. We are no longer in charge. And whatever they decide is what the government takes, is what the country takes. Okay? And not that we are short of evidence to convict these people. We have convicted a lot of them. Yes? We have had a whole lot of conviction. But what I'm saying to the Liberian people is that the road is smooth. We can make it. Nothing is lost. We are balanced. Our law is good. Our plan, our national drug policy is also good. The only thing we need is money, commitment, loyalty to this job.
Okay.
And this is not only government issue. As my colleague has said, in Ghana, you have private individuals who have rehabilitation centers.
Okay.
You have private individuals, you got churches who have rehabilitation center.
Okay.
You
So
have
it's more everyone coordinating,
everybody should
to
come on
move
board.
this forward.
The message of
Okay.
Ban Ki-moon, the former Secretary General of the United Nations in 2011 was, let all get involved with this thing, because you don't sit down on the fence and say DEA or and say police. Let all get involved. You have a role to play. A child that is taking the drug come from home. You got family. The family should try to consolidate their family.
Okay. So
Institutions to try to consolidate their institutions. Even at workplace, there should be policy against drug use.
Okay, thank you so
That
much.
will help other.
We have to get some more time. We have to get some more time.
Yeah,
to bring
they
you
ought to
back
get
to
on board.
discuss this
Right,
extensively,
they ought to
because
get on board.
it's a serious social problem.
Yeah.
The future is bright.
and it's a
The
serious
future is very
issue.
bright. They ought to get on
I
board.
think
But
that
thank
is
you
important.
for that.
In Ghana, we had such a program,
Okay, on the
and the
radio.
GBC, on TV, and GBC has agreed that
Yeah.
we should come back for 3 hours.
Yeah.
That's what you ought to do. You should be
Okay.
doing a
So
3-hour program.
we can all form a partnership, discuss it,
Yeah,
and look
so
into
that
it
it's
and
an
do it.
ongoing.
But thank you very much for joining us this
Thank you.
morning.
Thank
Thank you very much.
Yeah. Thank you.